So cosmetic dentistry, smiles, makeovers, you do a lot of it in your practice.
I do.
So who's the typical patient?
Typical patient comes in and they've either got discolored teeth or they have a lot of wear, and we're restoring them back to their length. And typically, even with the patients that have wear, the teeth are discolored because the stains of life have seeped in. So we will.
When you say wear, we're talking about like their front teeth are like worn down, where they're short.
They're shorter. They're shorter than they are wide.
Okay.
And they're flat across. It's a normal aesthetic appearance is it follows the lower lip, which is a little parabola, little curve like that, right?
Okay.
Just like you.
All right. Well, thank you.
Yes, sir. And so we'll start out with photography, and we'll blueprint, what I call blueprint them. We'll take models, and then we'll do a wax up in cosmetic wax and show them what it can look like. And then
so they get to kind of see it ahead of time.
They get to preview it. That's my standard way of doing things. And that saves us a lot of time because a patient can give me feedback. We also have a catalog called the Smile Catalog that has all different shapes of those edges. So
they can kind of pick their smile.
It's got 9 different categories, I think, and you just pick out what you gravitate to, what you like. And then we'll apply that to the wax up, which becomes the blueprint. And that's what it becomes our blueprint for the temporaries that we make, because usually it requires that we're getting rid of old fillings and lengthening the teeth. So when the day we do it, the patient leaves with basically a trial smile. They get to see what their smile is going to look like.
So they wear a temporary set of teeth
until the lab finishes making the teeth. Yeah, the veneers or the crowns.
So they get to see it ahead of time.
They get to see it ahead of time, and then we'll get them back, and if they have any suggestions or they don't like a little certain thing, then we'll tweak it, get them back, tweak it, and then we'll photograph or take impressions of that, and that goes to my lab that does beautiful work. And then they basically just duplicate it in the shade that the patient wants and the color that's age appropriate.
Now, because you have like lasers, things like that, you're big on that the gums frame the smile.
Yes.
Elaborate on that.
Yeah. So we have the BioLase laser, it's called water lase, and it's beautiful it's a beautiful instrument for contouring the gums to make the teeth the nice parabolic shapes that we want to enhance the smile, because that can be uneven.
Okay.
The gums can be uneven, and sometimes we need to correct that if the patient wants to correct it or they have a high lip line.
And
it just adds to the whole.
You could do a smile makeover on someone with really, really bad teeth and even some bad gums.
Absolutely.
As a periodontics. You just clean up the infection.
Yeah. We would start out cleaning up the infection and let that resolve. We wouldn't do that all at one time.
Okay.
But if you clean up the infection, we can use the PerioLase for that, and which is very non-invasive, and patients heal great after that. They don't have a lot of discomfort.